Hello, ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! PGY1 Residency Interview Presentation Critique. So in this video, I have a pharmacy student who has a residency interview for a PGY1 position, and she is required to do a presentation. Now they gave her a topic and the presentation must be done in 10 minutes. So she asked me if I can review this presentation, critique it, and give feedback. So in this video, that is exactly what I'm going to do, so you don't want to miss out. So here we have the title slide. And what I noticed right away is the hyperkalemia. The K should not be capital, okay? So she needs to change that. And then she has her name down here, and then she has PGY1 applicant. Me personally, I wouldn't do that. I will put my name, and if I'm in school currently, like she is, I will put my school name, and then I will put the date. I wouldn't necessarily put PGY1 applicant, but this is not a big deal, so it doesn't really matter. For the objective slide, before I even critique it, the first thing that I was looking forward, slide numbers, okay? So make sure you always have your slide numbers. And I recommend to do this in the beginning, right? So that you don't forget, because sometimes you get caught up and you say you're going to do it, but then you end up forgetting, okay? So just do it in the beginning. For the objectives, it's too small. I mean, it's only 3 bullets, right? And also the font is pretty small, so she has to increase the font. And also for the first bullet, define hyperkalemia, the signs and symptoms, and etiology, she can actually divide this into 3 objectives, okay? So that's probably better so that it kind of fills the page. And this line that's going across the page, I wouldn't recommend, simply because once you increase the font of the objectives and you increase the number of the objectives, it's possible that it might touch that line. So that's kind of distracting also, right? It's right in the middle of the slide. So people's eyes may be too focused on that. So here she has introduction by itself on a slide. And I actually like the way this looks. I personally don't do this, but I have no issues with this. What is hyperkalemia? Now, I would recommend not to make the title a question. I mean, try your very best. Sometimes I know it may be a little bit difficult, but you could just say, in this case, hyperkalemia. And then in the body of the slide, you could have a bold title and say, what is hyperkalemia? And then you go on and you define it. So I would definitely recommend that than to have the question as the title. Potentially life-threatening metabolic abnormality caused by. So she has 3 bullets here, right? The first 2 bullets are the 2 mechanisms that may cause hyperkalemia. And then the third bullet, she's saying a combination of both. You don't necessarily need to have that bullet, right? Because obviously if one could happen, 2 can also happen, and both of them can happen at the same time. It's possible. Either way, that's something that you could say, right? Always remember your audience. These are pharmacists, right? Preceptors, there might be students in there and whatnot. So these are things you could just say. You don't necessarily need to put that on a slide, right? Etiology. I like the fact that the slide title is etiology instead of causes. I feel like that's a more professional medical terminology. I don't like the fact that the table is named. I don't usually do this. I don't think I've seen people actually do this. You don't need to title the table again, right, on the side. I want to know you guys' input on this part because I've never seen that. Okay, for this table, she has the agents here that may cause hyperkalemia. Okay, now my question, let's say if I was at the presentation, I would think, okay, so you said there's 2 types of mechanisms, right, that could lead to hyperkalemia. But then you have these agents here. Are they following different mechanisms, right? Are they following the first mechanism or the second mechanism? So make sure you could include some kind of identification of that. Divide this table with the agents based on the type of mechanism, right? So for example, ARBs and ACE inhibitors, for them, they will be the first mechanism where there is an inability of the kidneys to excrete potassium. And the agents that follow the second mechanism, I will identify that also. Another thing I would recommend is that you have a lot of agents in this table, okay? So remember, anything you put on your slide is fair game. So that's why you don't want to do certain things that might harm you. You know what I mean? Like having all these agents on a slide, it's fair game. But do you know how each one works, right? And do you know certain random information about some of these? Because it's fair game. The digoxin, right, toxic levels may lead to a question such as, what is the mechanism of digoxin, right? Where, simply digoxin may be under the category where the impairment of the mechanism that moves the potassium into the cell, right? It may be that mechanism, but the fact that it's here, they might ask the whole mechanism of the digoxin in general. Okay, I hope that was clear. So I would reduce the number and just kind of list the common ones that you probably see instead of having all of these here. Etiology continued. Disorders causing hyperkalemia. Okay, so one thing that I noticed right away is that the previous slide was a table, right, with the examples. Now it looks like you have a picture, and you have to try to maintain consistency always. So I wouldn't really recommend this. It's either you use pictures for both, or you make this one into a table. And once again, try to limit the amount of examples that you put, because the more information you put on your slide, the more harm you're doing to yourself. And before I continue, another thing I've noticed that I forgot to mention is that you have to put your references in your slide, okay? I'm sure you probably have a reference slide at the end with all the references, but it's also nice if you put it on the slide and just make it really, really small that, somebody could see it, but they can't really read it. So even if like you made a mistake with that reference, it's still low key. Okay, clinical presentation. Once again, I love the fact that you used clinical presentation instead of, let's say, signs and symptoms, right? And then you have in the body the signs and symptoms. Now, for the signs and symptoms, always remember you want to go from mild to more severe, right? So, for example, you can't go from, let's say, heart attack to hypertension. You must list hypertension first. And that's usually the order that I follow. So here I see that you have EKG changes, and then you say that it's typically asymptomatic. They may have some muscle weakness, okay, paralysis, heart palpitations. I'll probably move the EKG changes down and make it last, and everything else seems okay. And I like that you have the picture here that kind of shows what's happening on the EKG. Now, once again, anything you put on your slide is fair game, right? So I could simply ask you questions about this whole EKG, right? Everything here is fair game. Treatment, goals of therapy. So I'm quickly going to just skim through this. It's fine. I don't really have any concerns with this one. Treatment, acute. I see you have your medications here in the first column, the dosage, the onset, the length of effect, mechanism of action, and cautions. Okay, so you have 6 different columns. So this picture might be a little bit small, okay? Some people may be able to see this, but there's gonna be a few, maybe one or two that probably can't see it, maybe because they're sitting in the back and they also have poor eyesight, okay? So this is something they will probably bring up. What I would recommend is make a table out of this so that you have control over what you could add and what you could take out. And then the cautions, it looks good, but for the insulin part, you could shorten that, right? Here you're saying that the patient, right, they should consider a 5% dextrose solution, infusion. I mean, if you're given insulin, obviously, right, you probably don't even need to put that. And this should help make the table a little bit more smaller and look better on the slide. Treatment, chronic. Okay, so I had mentioned this earlier in this presentation, but always try to maintain consistency, right? For the acute treatment, you have a picture, but for the chronic treatment, you have a table. Okay, so try to maintain the consistency and, if possible, make the column names the same among the acute and the chronic treatment. And also, you have the dates here that they were approved. I mean, you don't necessarily need that, okay? So I think you should just remove that so that it's consistent with the acute treatment. You have the mechanism here, right? This is beautiful, right? Straight to the point. Then you have the dosing here, which I think that's totally fine. But for here, the PO, you have the dose. You just have 8.4 grams, 16.8 grams, 25.2 gram packets. I mean, are these really the dosing, or this is just like the different packaging size, right? I'm a little confused. So make sure you take a look at that. I love the fact that you have the onset here, but you have onset listed in every single row. You don't need to do that, right? You could just make the title here onset and then have something about, cautions or clinical pearls on the side, very similar to the previous table. Okay, the first time I saw this slide, I was like, why? Why would you even do this to yourself? Okay, why would you even put a complicated diagram like this on your thing, right? On your presentation, unless if you know it in and out. And I actually asked her, she didn't really know what was going on. She couldn't really explain it to me that well. So make sure you either know it in and out or you don't put it here. And also, I don't really know what's going on. It's a global study, right? It's a study about something, but there's nothing that's telling me the study design, the real title, the interventions, the study question. Please, when you are putting like a study, right, a summary of a study in a presentation, I recommend something known as the SNPIC, and this is a little acronym that I use in order to effectively, transcribe the important information regarding the study into the slide so that it's not too much and it's not too little. So I will be posting a video on that, so just look out for that. But anyways, you could do something very simple, right? Make sure you have the study design at least. Tell us the question that they're evaluating the study, the interventions, right? Group A is getting this, group B is getting that, and then give us the result. So same thing here. I mean, I'm not saying that it's bad to have like a diagram like this on your slide. And I don't want you to be completely ignorant where you don't want to learn about this neither. But I'm just saying, if it's on your slide, it's fair game. So if you don't know everything about it, don't put it on your slide. Just don't do it. For the references, I hope this is not how she planned on leaving it. This is not the right way to cite references, okay? So whether it's a website, a clinical trial, a chapter from a book, whatever it is, I would recommend to go on easybib.com. That's what I usually use. It's free and they cite it amazingly for you. And that would be the end of this video. Make sure if this video was helpful, you like, comment, subscribe, and share. And I hope you was able to take something out of this video. So there may be certain things that I critiqued on or I said that you probably thought was obvious. But there may be certain things that you probably didn't know. So I mean, just take your time, watch the video, and try to also critique. You may point out certain things that I may have not noticed, or you may have a different opinion on certain critiques. Okay? Make sure to follow me on these social media platforms. And once again, thank you guys for watching this video. Peace out.